I thank you for our visit to Washington, D.C. We had a good time. Thank you for your office staff people taking this around. I think I am in the minority here, but I still think I have a right to speak. And what I would like to say is, I know that a lot of people are saying that the health care reform would cost a lot of money. And they're saying that it might cost $1 trillion over 10 years. During the Bush administration, you voted for $1 trillion tax cut, and you never seemed to ask where that money was coming from. You voted for a $3 trillion war and never asked for where the money was. You voted for a bill, a drug bill that was brought to the House floor in the middle of the night that was 1,000 pages long. You voted for a drug bill that was written by the pharmaceutical companies, and you voted for that bill, and you never asked where that money was coming from. So I would really, this is not a rallying thing, I really would like my questions answered.
Thank you very much, and I'm delighted that you're here, and I will share back the microphone with you for rebuttal. The drug manufacturing firms did not write the bill. I helped write it. The bill provides virtually to every single senior, and especially those that cannot afford it, a drug option whereby a senior does not have to be in the hospital to receive drugs. We made it large enough that it would be in such a way that virtually 100%, they're in the 100% marketplace instead of the 17% marketplace. 17% equals about the size of seniors who would have qualified. You don't get near the discount. And despite what talking points from Nancy Pelosi have told you at the time, this bill is an amazing success. It has changed where over the last 4 years that we've been on this, 1 million fewer people every year that have spent the night in the hospital, seniors, because they didn't have to go to the hospital to get well. Drugs have made them well. We have a formulary that is robust. It virtually includes every single drug that would be available. If you go to the VA, you only get the generics. If you go to the Medicare prescription drug bill Part D, you get virtually any medicine that has been approved by the government. We have saved exponentially some $400 billion less expensive today than we thought it would be. As you recall, we were attacked saying we padded the books that it was going to be far more expensive than what everybody said it was. But what happened is Republicans understand the marketplace. And what happened is Walmart came out with $4 drugs.
Yes.
It is run by the free enterprise system, not the government. I did vote for and have supported the war for funding. I also voted for a tax cut that employed 5.3 million new people. And I have seen my friends the Democrats spend 3 times that amount, and our unemployment skyrocket and our national debt balloon. And the difference between the two is this, is the tax cuts brought in an amazing amount of revenue from 5.3 million people having jobs. And this economic stimulus by Mr. Obama and Mrs. Pelosi have cost us jobs. The numbers are quite telling. And that is that cap and trade will cost us about 7.2 million jobs and new health care 4.7 million jobs, in addition to what we've already lost. I do appreciate the gentlewoman being here. I do believe that the things that I voted on are by popular demand. They have results.
I understand that it is my understanding that well, I have a personal example. I have a sister who has a kidney transplant. It didn't take her long to be in the donut. She makes about $12,000 a year as a teacher's aide. It didn't take her long to be in the donut, so it didn't actually help her. She's 67 years old. She's been having that for, I don't know, maybe 5 years. So the drug program didn't help everyone. Your statistics about the unemployment, I don't know if you and the rest of the people here know or not that I assume you are willing to admit that the economic downturn happened during George Bush's administration. Is that if you, since you are opposed to, I guess I haven't heard you say this yet, opposed to a government-run health care plan, if that includes your government-run health care plan. I'm sorry? Your health care plan that you have as being a congressman.
I appreciate the gentlewoman being here. I do not accept the government insurance and have not been on it in 13 years. You may count me as no on the bill. And I am not congressman for your sister or the person that you spoke about, but under federal law, she would be considered eligible for Medicaid and would automatically identify herself where she would qualify unless she has assets of more than $500,000.